Hi friends, I am Dr SAUMIL Mandalia. I work as consultant spine and joint specialist in Ahmedabad, Gujarat, India. Friends, I will discuss about slip disc at L4-5 or L5-S1 level in this video. Now this slip disc at L4-5, L5-S1 is one of the most common complaint with which any patient would turn up to a spine specialist's OPD. If you watch this video till end, you will understand what is disc, what is slip disc, what are the symptoms of slip disc, why it is so much common at L4, L5 or L5S1 level, what is the diagnosis criteria and how can you treat it or prevent it. Now let us understand what is disc. If you see, this is a model of a human spine. If you see any person from front, the spine is like this. From back, the spine is like this. And from side, spine is like this. If you touch your back, you will feel some bony prominence in your back. That bony prominence is this. That is known as spinous process. Now, if you see, these are the small vertebrae. This white structure is vertebra. If you see this structure, that is bone, that is vertebra. After that, there is transparent thing which is known as disc. Now there is bone, disc, bone, disc. Between each of these two vertebra, there is disc, and behind the disc there is a nerve. This yellow structure, if you can see, that is nerve, that is spinal cord. So whenever this disc goes behind, it presses on the nerve. It gives symptoms on your hand or your legs depending on the location of a disc. Now what is disc? Disc is made up of two materials. The inside layer is soft, jelly-like, and the outer layer is very thick, that is known as annulus fibrosus. Now, the function of the disc, whenever you walk, jog, run, any kind of stress which comes from below to up, it gets reduced by a disc. Disc works as a shock absorber. It reduces the stress going from below to up till your brain. So whenever there is excessive stress which your disc is not able to handle, the outer layer, that is thick layer, it gives way and the jelly-like material comes out, that is known as slip disc. Now depending on the location of a disc, it gives you symptoms. First symptom of a slip disc is back pain. Whenever that outer layer breaks, there is severe back pain. Now that jelly-like material comes out, it starts pressing on your nerve. If it presses the left side nerve, it gives you pain in left leg. Right side, it gives you pain in right leg. If it is pressing the whole spinal cord, it might give you pain in both legs. Additional symptoms are tingling, numbness, weakness in your legs. When there is severe disc prolapse, it might give you weakness of your knee, weakness of your foot, that is known as foot drop, or loss of sensation of urine and stool, that is urgency, that is known as cauda equina syndrome. Now how do you diagnose it? You first need to meet a spine specialist. He or she will do detailed examination of your lower back and legs, and along with the power of your muscles and sensation. Now depending on the examination, he might be able to give you provisional level of your slip disc. After that, we will require X-ray and MRI. MRI gives exact picture, exact level of a disc, how much severe is it and how much pressure it is giving on your nerves. It might be able to tell you what treatment you may require. Now, let us understand why it is so much common at L4-5 or L5-S1 level. See, whenever any person bends forward, 60 to 70% of movement occurs at L4-5 or L5-S1 level. That is the reason these two discs are continuously under pressure and there is very high chances of slip disc at this level. What can be the treatment of slip disc? You will feel relief to understand that 90 to 95% of patients of slip disc do not require any kind of procedure, any kind of surgery. Most of these patients can be treated by medicines, physiotherapy and rest. Medicines which gives relief from pain, which are muscle relaxants, which are neurogenic medications that reduces the tingling and numbness and reduces the inflammation. After taking medications for 5 to 7 days, you need to start physiotherapy. Now, what is the role of physiotherapy? Physiotherapy or back extension exercises increases strength of your muscles and prevents any kind of future recurrence of a slip disc. Most of the patients get relief from this kind of treatment. There are 5% of patients who may not get any relief with this approach. So after 10 to 15 days, if you don't get any relief, your doctor might advise you injection in your lower back, that is transforaminal root block. It is just 15 to 20 minutes procedure. The injection is being given in operation theater by a specialist, and patient can go walking with relief of pain within 20 minutes. And again, after 5 to 7 days, patient has to start exercises. Now, there are 1 to 2% of patients who do not get any relief with medicines, physiotherapy, rest, or root block, and these patients may require surgery. The surgery is known as discectomy, that is removal of the fragment or piece of a disc that has come out. Now, discectomy itself is very major topic, but I would still like to summarize it. Discectomy is done by three approaches. First is endoscope, second is by microscope, and third is by conventional open approach. Most likely, conventional open approach is not used nowadays, and we use endoscope. So, with endoscope, one tiny hole is made in your lower back, and in from that hole, we can put endoscope and remove the disc fragment. Within 2 hours, patient can start walking, and after around 6 hours, patient can go discharge to home also. This is very successful procedure, and most of the patients gets very good relief with this procedure. So in summary, I would just like to tell you what is slip disc. When that outer layer breaks, the jelly-like material comes out. It is known as slip disc. The symptoms are back pain, leg pain, tingling, numbness. In severe cases, there is weakness or loss of sensation of urine and stool. The diagnosis is made by spine specialist, X-ray and MRI. And in treatment, 95% of patients do not require anything. 2-3% may require injection in lower back, and only 1 or 2% patients may require surgery. Thank you.